Hi everyone, my name is Caitlin Kilroy, and I did my EBP project on VAP bundle compliance to reduce incidence of VAP. So, first discussing the significance of the problem, just a little background. VAP stands for ventilator-associated pneumonia. So patients on mechanical ventilation are all at risk for ventilator-associated pneumonia for multiple reasons. And of all the hospital-acquired infections, this is the leading cause of death. So some of the reasons that these patients on mechanical ventilation can end up with VAP is because of their decreased level of consciousness. They also have an impaired or absent gag reflex. They have an impaired or absent cough reflex, so they are unable to eliminate or get up those oropharyngeal secretions and remove them from the airway. And patients who acquire VAP are much more likely to be on mechanical ventilation longer. They're more likely to have longer stays in the ICU and be in the hospital longer in general. So in 2011 alone, there were 157,000 reported cases of VAP, which clearly proves that this is a significant problem in nursing healthcare for these patients who are critically ill already. So VAP has a prevalence rate of 5 to 27%, and it also has a mortality rate of 25 to 50%. So this leads me to my PICO question, which was, for the patient in the ICU on mechanical ventilation, does VAP bundle compliance reduce incidence of ventilator-associated pneumonia, or VAP? In order to obtain more information, I did a literature search. So I used 3 search engines. I used EBSCOhost, Google Scholar, and I also used Sage Online Journals. So I entered some keywords like ventilator-associated pneumonia, VAP bundle compliance, VAP rates or incidence, and ICU. I put limitations on the studies, so just showing studies from 2010 to 2018. I added full text articles only and made sure that they were within the United States. This led me to many articles, but the 3 that I landed on were from the following journals. I used them from Archives of Surgery, ICU Director, and International Journal for Quality Healthcare. So after that, and I came down with my 3 top articles, I did my synthesis of evidence table, which you can see in the middle of my poster. So I took 3 articles, the top 3, which I thought were the most informative, had just the best information in general, and this table just discusses the authors, the researchers, some of the methods used, any of the study variables. It talks about the measures, the results, the findings, the limitations, and also any recommendations that the authors or researchers came up with to improve healthcare and help the nursing practice in general for these patients. So after reviewing these top 3 articles and their recommendations, I came up with a list of my own based on the evidence. So my first recommendation would be implementation of a VAP bundle protocol policy, and it should be implemented in hospitals, and it should be implemented for all patients on mechanical ventilation in the hospital. So this policy should be developed and monitored by the hospital's infection control department, and the policy should be outlined. It should state all of the bundle components, and unit training and education should be provided to not only nurse managers but staff in general, because there are things that even like technical partners could assist with. So my second recommendation would be that each policy or the bundle protocol includes the following elements. It must include a head of bed elevation between 30 and 45 degrees, daily sedation breaks, daily assessments of extubation, peptic ulcer prophylaxis, deep vein thrombosis prophylaxis, and oral care using chlorhexidine mouthwash. Then a daily checklist should address each of the bundle items, and it should note compliance when the bundle items are completed. So that should be documented every shift. And then the data should be obtained weekly, and then it should be reviewed monthly. And it should be reviewed by a multidisciplinary team. So in conclusion, after doing all this research, I have found that evidence has shown that when a policy is implemented and there's high compliance noted, that VAP rates do actually reduce, or can be reduced for patients in the ICU who are on mechanical ventilation. So when a policy was implemented, Pogorzelska et al. Noted that when compliance was at 95% or greater, that VAP incidence was reduced significantly. So, thank you for listening. I hope you learned something about my project.